Welcome to today's webinar, Preparing for Camp and Beyond. Thank you for joining us today. My name is Laura Crone. I am the Project Manager for Research and Education at the Advocate Medical Group Adult Down Syndrome Center in Park Ridge, Illinois. We are a healthcare clinic for adolescents and adults with Down syndrome ages 12 and older. And since opening in 1992, our healthcare providers have seen over 6,000 patients with Down syndrome. In addition to providing patient care, we offer a variety of research and education opportunities, such as this webinar. Before I introduce our presenters, I have a few reminders. Next slide, please. The webinar is being recorded. The link to the recording and the slides from the webinar will be emailed to all attendees within 1 week. There will also be time for a Q&A at the end of the webinar. Please submit questions using the Q&A option in the Zoom toolbar. Next slide, please. We have 4 amazing presenters with us today who bring unique perspectives and knowledge to this topic. We have an occupational therapist, physical therapist, and 2 family physicians. I'm going to turn it over to them and let them introduce themselves. Thank you again for being here today.
Great. Hi, everyone. My name is Hannah Facey. I am a family physician. I work at the FAB Center for Complex Care, which is a medical home for adolescents and young adults who have complex childhood onset conditions. FAB stands for Adolescents and Beyond, and we're located in Philadelphia, Pennsylvania. I also wanted to mention one other person who's not on this slide. Jenny Newberry-Ross also was integral in helping us form this presentation, and she is the co-founder and executive director of Camp Pals. Then I'll pass it on to Katie.
Hi, everyone. I'm Katie Frank, occupational therapist at the Adult Down Syndrome Center in Park Ridge, Illinois. And I'm just really excited to be part of this talk with my fabulous friends here. Helen?
Hi, my name is Helen Milligan, and I am a full-time assistant professor in the physical therapy department at Thomas Jefferson University and a part-time clinician, physical therapist at the Trisomy 21 clinic at the Children's Hospital of Philadelphia. And I have a 21-year-old son, Aiden, who has Down syndrome. Okay, Mary, you're on.
Okay, hi. I'm thrilled to be here and to be presenting with some of my clinical colleagues and idols. I am at the FAB Center with Hannah Facey, and I'm also the clinical lead of the Teen and Adult Down Syndrome Consult Program at Christiana Care in Wilmington, Delaware. I am the mom of a now 13-year-old with Down syndrome and have been a volunteer doc with Special Olympics and Camp Pals.
Okay, so I'm going to get us started. We are also excited to talk to you all about this topic. So I'm going to go ahead and start by just giving a little disclaimer. Information in the presentation is just for educational purposes, not intended to serve as a substitute for medical care. So some things we're going to cover. So the first thing we're going to do is just start to brainstorm things to think about before heading off for some time away from home. So we will start with a couple questions. If you want to participate, you can comment into the chat. You can do so anonymously too, if you would like. We're also going to talk about some ways to plan ahead to set up for success. We'll talk about defining consent, what that looks like, going over helpful tips and tricks for hygiene practices and sharing space with others. Consider practical footwear considerations, and then review common medication questions and concerns. So just a question to get us warmed up. And like I said, if you would like to comment, feel free. So thinking about going away somewhere like camp or really anywhere else for like a weekend away, what looks different in a shared living space compared to your home environment? So I'll give you a few seconds just to kind of think that through. Okay, and so some things that come to mind. So we think about communal bathrooms, which look different from the ones at home, most likely. Living with roommates, so not just being on your own in your bedroom like you're normally used to, potentially different furniture, not having the same kind of temperature control that you would have in your home environment. Nighttime routine might be a little bit different. So thinking about night lights, having a table next to bed, just the setup being very different potentially. Access to garbage cans, where those things might be located in a communal space where you normally at home might have it right next to your bed. Different storage areas for clothes and personal items. So these are just some things, but obviously, as this shows, just a lot of things can be very different than they are when you're at home. And then so another question just to think about. So say you're going to be going to camp for the first time this summer, you're so excited. What are some things that you think that you need to pack? And it looks like someone put in the chat for the previous question about things that look different. Someone commented, Marcy Strauss said, my friend had a one knob shower control when she went to college program. It was two knobs. So simple to us, but not for them. Exactly. So tons of things that can be different. Um, and then when thinking about things to pack, some things that I thought about, a lot of things that you need at home. So clothes, lots of different kinds of clothes. You might need clothes for hot weather. It might be chilly at night. You might need to bring a water bottle. You need to bring things to shower. You need to bring lots of different shoes potentially. Um, Anyone else have any other thoughts on our of our lovely panelists?
Talked about sunscreen and bug spray and rain gear.
Yeah, durable medical equipment. Great.
And I would say just to be aware of what the packing list includes and get that packing list early so that you can make sure that you do have everything packed and ready to go. And that your camper knows exactly what is packed and how you're packing. So they know they have it there and it's not like hidden away in a secret compartment in a suitcase or something.
Great, thanks, Helen. So that kind of leads into our next slide. So I think the biggest thing for this that we want to start things off to think about is just planning ahead. That's really the biggest thing. So reading those packing lists weeks or even months in advance and making your own lists. So if you're going away to camp and you know that they have a list that may have some, predetermined things to think about, like as soon as you get that, start thinking about it. Start setting items aside, thinking about what do you have to buy, things like that. Thinking about the rules of where you're going. Like, are there some things that you need to do independently, like handling all your personal hygiene needs, that may be some things you have to work on ahead of time. And then think about the things that you're going to need daily and throughout your time away to be happy and healthy. Are there personal items that are going to make your stay more comfortable? Are there, support items that you feel like are ones that you can't live without and can't go without to camp? So making sure you keep those things in mind too. Let me just pull up the chat too. Oh yeah, medication supplements too. Also a good one to think about. And we will get into that more at the end of the presentation too. So one tip that Helen's son Aiden actually has used previously is thinking about packing a full outfit in gallon bags. So if you can see the labels on the bags, I love this, the SSU, it's the shirts, shorts, underwear. So very quick, simple. You know that you have a full outfit for the day ready to go. So you're not having to scramble looking through your suitcase when you're there. And then you can also label bags of special events. So if you know you're going somewhere where there's going to be dances, fashion shows, anything that you need particular clothing, you can pack those in separate bags too so that you're all set and can be stress-free when you're thinking about outfits. All right. And then another thing to think about too is just make a training plan. So think about areas that you need practice in. Think about them way ahead so you can practice those at home. Make a list, cross off areas once independence is achieved. Think about doing verbal and visual cues or lists when necessary. Another thing to think about too is just being open and honest with counselors or peers if support is needed during camp and identifying those people that might be of assistance to you. Another thing to think about too is accidents happen. It's okay to throw away a pair of underwear at camp. It's okay to just have a lot of extra items just in case. Prepare for that ahead of time. All right, and I'm going to pass this off to Katie.
So another important concept to really make sure that you instill in your loved one before they go off for a weekend or sports camp or Camp Pals or college or whatever it might be is consent. And when I teach about consent, I talk about how it's giving permission. And it's important to let them know that no one should touch or see their body without their permission. And that you must give consent every time, even if you gave permission one time. So before camp, you might want to help your loved one identify who the individual can ask for help from or accept help from. And knowing that people still need to ask if help is needed or wanted before providing assistance. And letting your loved one know that it's okay to say, I don't need help, I've got this, if they really don't need assistance. And just because a counselor or coach thinks you should do something does not mean you have to. I heard of a instance where someone went away to a gymnastics competition. She happened to be menstruating, so the coach just inserted a tampon kind of without her permission and without talking to the parent. And that is, an invasion of privacy, and it's really inappropriate. And so just because the coach says something, even though the coach may be a trusted adult, doesn't necessarily mean that you have to do it. Again, you need to be giving permission. And the other thing is to know that it's okay to ask for help if you need it. So a lot of our individuals with Down syndrome think I'm an adult. Adults don't ask for help. If I ask for help, that makes me less independent. And that's not necessarily the case. We reiterate all the time that everyone asks for help if they need it, and it doesn't make them less independent. So it's important that your loved one knows that. Next slide. And so teaching about consent can be hard at times. And so we do have a story about consent in our resource library, and the link is there. And many of the resources that we will share today are found in our resource library. But there's also a great video on YouTube that kind of explains consent, because we know that individuals with Down syndrome learn best with visual supports. It's not just what they hear. They need to kind of see and hear it at the same time, so that they can process and really understand what is being taught. Gosh, I was just thinking about something else around consent and I totally forgot. I'm sure I'll come back to it. Next slide. Oh, I do know, and it kind of goes along with public and private as well. A way that you can practice consent in your home, because it's really important for you to model the behaviors that you want your loved one to also have, is that making sure that you're knocking on the door before entering their room or the bathroom and waiting for their permission to enter. Or if you need to assist with self-care tasks, ask their permission before touching them. Don't just assume because you're the parent and you know they need help, you should be just jumping in and touching them. And so if you're doing this, they'll understand that everyone should be asking their permission first. And so it's a great tool to incorporate into your daily routine. The other thing that is really important when being in a communal space, whether it's camp or college or sharing a hotel room with someone, is the concepts of public and private. And so when we talk about private, there's private behaviors, there's private body parts, there's private talk, and there's private places. And so this story kind of talks about that. And it can be really challenging because at home, their bedroom, if they don't share it, is private for them. And their bathroom at home, if they don't share it with anyone, or if they can be in there by themselves with the door closed, is a private space. But when you're out in the community, all of those things could be public if you're sharing those spaces with others. So there might be a public restroom that has multiple shower stalls and multiple bathroom stalls. So then they are still in a public restroom, right? And so you have to then teach them what makes it private. They shouldn't just be walking into a communal bathroom naked, right? They still need to be clothed, because being naked is a private behavior and you need to be behind a door or a curtain that closes so that no one can see. And so it's important to teach the different concepts of public and private. And again, in our resource library, we have a story about privacy for boys as well as a story about privacy for girls. Next slide. And some resources just on shared spaces, because as Hannah mentioned, things can be different when you're in a shared space compared to your own space. So we have a whole resource about tips for living with housemates, but this could be with, I mean, even if you're sharing a cabin, or going away with a friend and their family, whatever it might be. And so this is like kind of the tip sheet, but then there are descriptions for each one of those if you wanted to talk about one skill specifically. And then it's also important to understand boundaries. So whether it's personal boundaries, that's kind of our personal space, and who and how we touch other people, whether it's social boundaries, so it's conversation topics and making sure that we're not talking about private things in public, but also how much we call or text people. And then environmental boundaries. So respecting the spaces that are shared spaces. So that might be not littering, but it also could be not taking something that isn't yours if you're sharing a room with someone, or knocking on a door, not borrowing things without asking, not borrowing something and breaking it and not apologizing, things like that. And so again, there's some resources in our resource library to help teach some of those concepts. Next slide. All right. So that's kind of a lot of the planning. And now we're going to talk about some of the hygiene tasks. And again, as an occupational therapist, this is kind of the bread and butter, what many OTs provide. And so it's important to think about the steps of each task that your loved one needs to have the skill set for in order to do this in a setting where you may not be present. So whether it's, reminding them to wipe when they're using the toilet and teaching them that, because a lot of individuals with Down syndrome, because of their smaller hands or shorter arms, they may be overweight, plus the concept of wiping is a very abstract concept, can make it very challenging to wipe after having a bowel movement. And so it's important to practice that. And there's ways you can do that with items that don't involve bathing in order to practice. So maybe they're reaching behind their back for a ball so that they know exactly how far back they need to reach. And then you start practicing with having them wipe something, whether it's like shaving cream or chocolate sauce or something like that, off of their skin so that they can learn where they need to go. But you don't necessarily need to break things down into all of these steps if your loved one's already capable of some of these tasks. Also, knowing things like maybe at your house you like to conserve water, so you don't flush number ones but you flush number twos. But if you're sharing a communal space, you probably should flush all the time, right? It's not, you don't have to worry so much about conserving water. It's more important that you are being private about your behaviors. Same thing with the shower routine, as was mentioned in the chat. Showers are set up differently, whether there's one handle or two. Maybe you already have accommodations at home so they know how to do the water temperature, but perhaps they need assistance with that. But once the temperature of the water's set, they can do everything else by themselves. So you notify the support staff or the peers that that's what they need help with. At home, maybe they have pump bottles for their shampoo or conditioner. Well, you might want to consider just bringing, a 3-in-1 so they don't have to think so much about my shampoo, my conditioner, my body wash. Perhaps if it's just for a weekend or a week, is it really that big of a deal? They might have dandruff shampoo that you want them to use, but again, it's just a week. Is it going to be the end of the world if they're not using their medicated shampoo or their dandruff shampoo? Maybe they use a washcloth at home, but you want to send a loofah. You need to practice with these things if anything is going to be different. And again, maybe they use a handheld shower head at home, but there's only a fixed shower head where they're going. So again, you try to think about all possibilities and plan for them. The other thing that this group of us have been talking about is maybe it would be helpful if places like Special Olympics camps and Camp Pals have resources like this, these pictures in the bathrooms for everybody, just as a reminder, so it doesn't like stand out that only one person needs visuals. They're not super independent in their bathing or whatever it might be. Same thing with washing hair, brushing teeth. If they have to tie their shoes and they have they struggle with it, there's a technique that does the 2 bunny ears. But if you put the plastic tabs into one of the holes of the shoes, it creates your bunny ears for you. So it takes away that fine motor component. And then you just make your X, loop it under and pull, and you do the same thing a second time. And you end up having your shoe double knotted. And then there's also, and we'll show, we won't show the whole video, but for putting your hair in a ponytail. So some girls really want their hair in a ponytail, but their mom or dad or sister always helps. We have a video that shows how to put your hair in a ponytail. Next slide. And I think that's it, but other things to think about with, oh, sorry, Hannah. With long hair, I had mentioned maybe do a 3-in-1, but if they have really long hair and it gets tangled, perhaps you want to bring the conditioner. Have them practice combing or brushing their hair after the shower. You typically do it, but make sure that they're able to do it. Even haphazardly, may not be perfect, but it's going to be better than not doing it all. And then make sure that they're practicing using the hair tie or the barrette or whatever, the clip that they're going to be bringing to camp with them. And then make sure to send a few extra of the same just so that they have them in case one breaks or snaps or they misplace it. All right, next slide. All right. And then there's the whole thing with menstruation. And we hear that when girls go to camp, if it's the week that they have their period, they may not swim the whole time. And so many individuals love to swim. So it's important to consider this when someone's going away. And so there's resources about getting your period, about when to change your menstrual hygiene product. Perhaps you create a plan for when they're going to do it at camp. This one talks about meal times. That's really easy. The other thing that's great is there's period panties now. So they might not even have to use a tampon if they're at gymnastics camp. They can put period panties on. They can also just bring period panties with them in case they have any breakthrough bleeding for the week. Helen said she was at sports camp and this happened to one of the girls and she didn't like how pads felt. So she didn't really want to use the pads. So she was wearing multiple pairs of shorts and underwear, but that really isn't functional. So practicing with period panties and just maybe those are their panties they wear all week long and it's, not a big deal. There's also swimwear now that you can wear that has period protection in it. So maybe that's another solution for when they go to camp. Just send that bathing suit. Next slide. And so again, the different menstrual hygiene products, whether it's period panties or tampons or pads, these are great resources for anyone, not just if they're going away for a weekend, but just to learn these skills because we see that most women with Down syndrome are very capable of managing their menstrual hygiene if they're given the tools to practice and learn. All right, next slide. All right, and so again, creating this plan before you go and what they're going to do and what happens if, so that they know maybe they're going to always wear their pads at night or their period panties, teach them how to put in a tampon and how to remove it. Because that's the one challenge I think with using tampons over pads or period panties is that, again, you take away that visual support. And so individuals may forget to remove it because they don't see, that the blood or the blood in the pad or the underwear, whatever it might be, might not see the string, they might not feel it, and so they don't change their tampon nearly as often as they should. But it's important that they are as independent as possible with period management when they go away. And so again, creating that plan about when they need to change their menstrual hygiene products and whatever it is that works for that individual. And so you can also create the visual support with the reminders. You can, if they wear a watch, set a timer, if they're allowed to have their phones with them, have those little reminders like, to cue them when you're not there. All right, next slide. And then I do see, before I pass it on to Helen, I do see that there's a question. How do you teach to use a tampon if not in their period? It is too dry. And I think Helen actually would be a great person to answer that before she talks about footwear.
Sure, I'd love to. Well, I just have been doing tampon, I'm calling them tampon training workshops, tampon learning workshops, where you talk about what exactly, show pictures of the female anatomy, take tampons out, take them apart, handle them, practice putting tampons into, say, like I have this toy water wiggle or one of the little things that you put on your arm when you swim, practice it outside of your body, practice it multiple times, and make sure if somebody wants to learn how to use a tampon, that they're comfortable with feeling it, touching it, and even the mechanics of moving it. With some of the people with Down syndrome who I've been a part of the tampon training workshops, that's actually a hard skill that we just take for granted. So holding the applicator and moving, I call it the plunger, up and down, and getting them just used to doing that with two hands before you're actually inserting it into your body. So there's ways to practice that, breaking the steps down before you're even inserting it into your body. But soon to come tampon training workshop, I will be making that available to everybody. But definitely practicing that, making sure they're comfortable, also possibly using a mirror, putting that on the floor so that they see what they're doing, and make sure that if they're not scared of it, and that they know that they can't push it up too far, that it's going to go in, make sure you don't feel it, and it's up in the vaginal canal far enough. And then I'm also showing them how the string, I usually have them practice that in the workshop, pull on the string really hard because so many people are afraid this string's going to break or it's not going to come out. So that's that in a short nutshell. But we're going to talk, I just returned from Pennsylvania Special Olympics Sports Camp, which is a week-long camp where we take athletes from all over the state of Pennsylvania up to this beautiful campground up in the mountains of Pittsburgh. And they play a variety of different special Olympic sports for the week. I am the main clinician for the volleyball camp, and then I'm the volleyball sport, and then I'm also a counselor in the cabins with some of our female Pennsylvania athletes. So it's another great way to get away for a week and really practice some of these things we're talking about. So footwear, as you can see, this picture is a picture of a piece of footwear that we would never use at camp or go away with, but it just kind of illustrates the idea that you want to make sure you have footwear ready to go, appropriate and supportive for, you know, people with Down syndrome who do have ligamentous laxity, flat feet, and need that extra support so that they can be successful and so that they can participate without having any knee, hip, back pain because of not having correct footwear. So why do we use different shoes? For protection, support, cushioning, grip, stability, of course, fashion, so that when we have our dance nights, we have that. For status, sometimes we'll wear certain types of footwear, and then of course for comfort. Okay. So what will we be doing when we go to camp? So Camp Pals is very different than sports camp. So at sports camp, they're doing a primary sport all morning long for 2.5, 3 hours before lunch. So you want to make sure you have that pair of footwear if you're on the volleyball court, if you're doing athletics, a good pair of sneakers. If you're going to bowling, that you have your bowling shoes, of course. And then considering how far you're going to be walking from wherever you are back to your cabin. And the same thing goes for if you're going away to college or if you're going on vacation. Make sure you have that correct footwear so that is not going to be the one factor that holds you back from fully participating. At camp, I checked my steps and we were getting at least 13,000 steps a day, often on uneven terrain, up and down hills. So making sure you have that correct footwear and possibly changing it at lunchtime to a different pair of sneakers, that's also helpful. Are you going to the pool? Do you need a pair of footwear or water shoes? Going to a dance, of course, and then shower shoes. So it's definitely advisable to bring a pair of flip-flops or slides. That's the other thing to practice at home. Going into the shower with that footwear on to make sure that it will work and that the person's comfortable. Showering with footwear on, that's a really different experience. And our particular shower this year was not exceptionally clean. So I told, you know, all the athletes, definitely wear your shower shoes in there and try to keep them on when you come out until you're going to change. And then of course, walking, if you're just in your dorm, walking around or walking in the cabin, you can of course wear like your Crocs or your other types of footwear. Okay. So what do we look for, especially for individuals with Down syndrome, for a good supportive shoe? So you want to make sure that there is some type of arch support and some kind of motion control in there so that they can get that forward and backward movement of their lower leg when they're walking. You want to take the shoe and make sure it has a flexible forefoot so that it can go back and forth, so they can use their muscles to balance when they're standing. You want to have a durable outsole or a non-slip outsole so that they're not going to slip and fall and they're going to feel supported, and that the back of the shoe has a good heel support. So ones that are like, say, a Converse that just collapses, that's just canvas, that's an example of not having a lot of support in the shoe for your heel. You want a tie shoe is ideal because you can tie it really tight and get that middle part of the foot supported, but some people are not tying their shoes independently. So if they're going with like an elastic lace or a Velcro, make sure that that elastic it's snug and tight and that the Velcro can go snug. They also have these fly ease ones that have strings that you can tighten once you put them on. So you know when you're sitting, you want to tighten that shoe nice and tight so that when you stand, your foot is supported. So you want to tie your shoes when you're sitting and not in weight bearing. And then make sure that there's plenty of room in the toes for your toes to spread, because again, you'll use your toes for balance and hopefully, and we don't want to have any calluses or problems with their feet while they're away. Calluses or blisters or anything like that. So that's the other thing. Make sure if you buy your shoe, you've worn it, tried it before you're heading away to camp where there's not a lot of options. And actually what happened to me, I had a pair of Keen sandals. They broke my second day at camp and I was able to order a quick pair on Amazon and they did arrive. So that might be an option if something does happen, to always think about that. Thank goodness for Amazon. So let's play a quick game. For those who have the chat, go ahead and put in the chat. We're going to rate these different, this footwear. So the first piece of footwear is a pair of Crocs. This would be my son, Aiden, who I'm going to throw under the bus here. His favorite piece of shoes. He thinks he can wear them to everything. He loves them. He'd wear them, morning, noon, and night. But what do we think on a 0 to 10? What do people think for that, for the footwears? Anyone? Oh, 5, 0. Okay, 5, 2. I could see that. I basically give Crocs, yeah, I think a 2. I think a 2 would be a good rating because it is giving you some of that foam support on your soles. It's a little bit better than, say, like a flip-flop or something. Some of the flip-flops, say like an Old Navy flip-flop with no support. It has the strap in the back, a little bit of the heel support, gives you lots of room to spread your toes, and you're pretty comfortable in those. Just a tiny bit of arch support, but not really much. So a 2. So you're going to use these going to the pool, walking around your cabin, things like that, but not when you're going to be going long distances. I agree. Okay, next one. What about this sneaker? So rate this sneaker. What do we think? Let's see. 6. Oh, wait. 2, 3, 10. Oh, wow, we have the gambit here. Okay. Well, this sneaker, I actually like this sneaker a lot because we can see in a sneaker, it has the tie laces. So that gives it some brownie points for me. So you can tie it nice and tight. It's got some arch support in there, a heel counter. We can't pick it up and turn it back and forth and up and down. But overall, this would be give the person a nice amount of support. Also, when the person contacts with their heel, when they're first starting to walk, it has some nice cushioning here. So that's good it's helpful for your ankles and your knees, your low back and your hips if you get that initial shock absorption when you contact the floor when you walk. So pretty good. I would say these could be like a 7, 8, maybe even a 9, but we don't know 100% for sure. Okay. Next. All right, what about our Uggs? Lots of people love to wear their Uggs in the winter. They're warm, they're cozy, they're comfortable. But what about all of our girls that wear them to school and they're having gym class or something like that? Let's see, what are we giving our Uggs for our scores? Yeah, I'd say you guys are good. Yeah, but I'd say it's 3, a 3 on the UGG, 3, 4. Yeah, because again, it's keeping your foot warm. It gives you lots of check marks for fashion, makes you feel good about yourself. You can usually put those on independently, so great for independence, but not great if you're going to be doing any kind of athletics or a long distance walking or anything like that. Okay, next one. And then here's Keen sandals. These are sandals that are made, they do have some arch support. They have a nice non-slip sole. And then you can also tighten them throughout the midfoot. So what do we think about these for sandals? Oh, 9. Okay, Catherine. Yeah, I like these a lot because if you're going to go with a sandal, you don't want your feet to be hot. It's been really warm this summer where we are in the Northeast. It's a nice option and it does give you a little bit of support, and you can tighten these pretty easily without having to know how to tie your shoes. So I typically have always bought Aiden a pair of these his entire life growing up, but he will no longer wear them anymore. So he stopped wearing them, but they were really great when he was younger in the summer months. Okay. And then we have our flip-flops here. Flip-flops with no arch support. What do we think for these? 0. Yeah, exactly. Okay, bingo. So, right. These are just, maybe taking a shower. You're on the beach, you don't want your feet to burn, but they're not going to give you any support. They're basically just providing a little bit of protection from either germs in the shower or like the heat of the sand, etc. But nothing you would wear for long distance walking. Okay, good job. Everyone did a great job. And then of course, this guy going out to play soccer. So would a slide be good to wear? No, of course not. You're going to wear maybe the slide to get there, but then when you get there, you change into your appropriate shoes to play. So be a champion and set yourself up for success, just like a professional athlete. We should have the same expectations for our athletes and individuals. And this is a picture of Aiden with Jordan Mailata from the Eagles. Just being a great role model and setting them up with the right footwear, clothing, etc., so that they can also succeed. All right, so let's practice. All right, go ahead, Hannah. So what would you wear to dancing? Appropriate. Maybe you're wearing your cowboy boots, your Uggs, something that you feel good with, something to have fun with. But sneakers, definitely if you were at sports camp, because you still have a hike to get to the dance, just so people know that when you're packing, you may have to have like a comfortable shoe that they're feeling good with. But I had an athlete this year, she had a little slip-on sneaker that she had just bought. It's really cute with a lot of sparkles on it. But we still had a long hike all the way up a gravel hill to get up there and then back at night in the dark. So we actually packed her shoes in a bag, brought the shoes up so she could change, but talking about that ahead of time. All right, go ahead. What's the next? Hiking. You're going to want to have a supported sneaker like this one. Go ahead, Hannah. Showering. Again, we have our flip-flops. Next one, basketball. Again, a supported sneaker, not necessarily a Converse because they don't give you a whole lot of support. And riding in a bus, you would just have a pair of shoes that you're comfortable with, maybe the Crocs or the Vans, but then realize when we got off the bus at sports camp, we had to get all our gear and bring it down to our cabins. So you would want to have a change so that you do have a supported shoe. All right. Going to dinner, you might want to be a little bit more dressy and you're not wearing something, you don't need as much support. Okay. And then hanging out in your room, whatever you want to wear. Oftentimes people with Down syndrome like to have bare feet. I know my son's barefoot all the time at home, so that's fine for a little bit. All right. So what do we think of these guys' footwear choices? This is the picture of Camp Pals. They're all at a dance, and you can see the one person, there's a couple people wearing Crocs, and Aiden is definitely one of them. So he went to a dance. I don't think they had to walk that far. That was a short amount of time. Versus you're out on the volleyball court at sports camp, you're going to make sure that you have your supported sneaker on and not showing up with a pair of Crocs. And then this dance, they're a little bit fancier. So just understanding and talking about that and even giving that rating to, the camper or the student, like, what are your shoes today? I would give those like a 6 out of 10. Oh, you're going to go train, you're going to go for this long walk or go play basketball or something. You want to make sure you have your 10 out of 10 shoes. So that's the way I talk and explain it to Aiden too. Like, you're going to wear your 10 out of 10 shoes if you're going to go, that's going to set you up for success. Okay. All right. Dr. Stevens.
Thanks, Helen. Hey, there was a question about Skechers, if you want to Skechers slip-ons and your rating for them.
Oh, okay. Yeah, any kind of Sketcher. And again, any brand, when people say that to me, they'll say like, what about a Nike? What about this? What about that? It really depends on the shoe. So with Skechers, they have all different brands of Skechers, and some are more supportive, and then some are more of the flat inside. So you want to look for a shoe that gives support for people with flat feet or pronated feet, and see if the ones, again, that the individual who wanted to they were Skechers, like fancy, and they had like glitter on them. They were stretchy and there was nothing to give her any kind of midfoot support. So what happens is when people with Down syndrome stand in them, they're just going to automatically pronate, which unlocks your foot and it sets them up to have an unstable foot. So just see if there's a way for a Velcro or some way to tighten that middle part of the foot. So in general, there's certain brands that are more supportive, like Hoka, Brooks, New Balance, some of the On Cloud ones, and then ones that provide not as much support, and Skechers kind of falls into that. But again, maybe we're at a 6, 7, 7, 8 instead of like a 9, 10.
So I guess there's more clarification needed around this. Apparently I changed it to slip-ons, but it really was slip-in. So obviously I know nothing about this. And did you want to clarify your slip-ins not ideal compared to lace-ups?
So that's where I'm like, there's so much to think about. So independence is huge in my book. And I think having someone come to camp, if they can't tie their shoes and they have a pair of ones that slip in or like are that stretchy kinds, I'd have to look at them. And I also do this test of the standing on one foot balance test. So for instance, Aiden cannot stand on one foot, maybe 1, 2 seconds in bare feet. If he has his Crocs on, same thing, 1, 2, 3 seconds. If he has his good Hokas on, or I just got him, they're like Brooks, and then he has an insert too, orthotic, and we tie them tight, 15, 20 seconds, he can stand on one foot. So you can see just with that, wearing different shoes or sneakers can make a big functional difference. So again, I would say a tie sneaker with a good insert inside the shoe, tied tight, is going to give you more of a 10 out of 10 and set them up for the best success.
And then one more question before we move on to meds. Do you suggest custom orthotics?
Okay, I've been using these kid soles that you can order them online. And what's the ones that I'm using now? There's a kid sole that gives you more support, and I don't get any kickback on these at all, but they're only about $25, and I've bought like 3 or 4 different ones for Aiden, and we've tried them in his shoes to see A, what he likes, B, which ones help him with his balance and his function. But having an insert or some type of support in their shoe is really, in general, helpful for people with Down syndrome. That being said, there are people that I see in our clinic that because they haven't worn one in a long time, you kind of have to wean into something. So you would go with a softer one first versus something that's more corrective. And then some people I see actually do need a custom orthotic because of how much pronation they have or deformity. And there's different ones. So you could work with a physical therapist to decide or talk about different ones. There's softer ones made out of cork. There's harder ones made out of plastic. And there's all different styles of those.
All right, Helen, I'm going to move on to meds,
Yeah,
but maybe
ahead.
you could
I'll put it in the chat.
type it in the chat. J1 is another version that I've heard recommended at Dismig before.
There's a lot of over-the-counter ones.
Yep.
There's a bunch of different ones.
All right, so moving on. So as a doc, I'm used to prescribing meds, but at camp, I also have to distribute them, and it's really been eye-opening. And of course, as a mom, you learn how to give meds in all different kind of conditions. So here we go. Next slide, please. So I think it's really important to know the rules early. So if you're going to an accredited camp experience, likely you're going to have to pack original bottles or blister packs that are made at your local pharmacy, or there's some pharmacies that you can find online that will kind of package them. And this is Monday morning meds. Here's Tuesday afternoon. While many of us rely on things like med planners, they're often a no-go. And so really read through those instructions. With the folks that I know with Down syndrome, many, find their groove, and that's the way it needs to be. The OCD is a little strong, so you kind of have to have the discussion. No, you're not going to get your own med planner out. You're going to actually go to a med room before breakfast to take your thyroid medicine. No, will the meds be dispensed by a medical professional or a coach? Know the level of support. Things are getting increasingly sophisticated, and we had patients with insulin pumps at camp. Fortunately, there was a great nurse who was able to coach the patient through the change during the week, but you gotta set that stuff up in advance. And then when you fill in those camp forms, look and see if there's a preferred time to give meds. And is there any way you can simplify your loved one's schedule in advance so they can kind of go with the flow and be with their friends and not spend a lot of time in line at the med room? Generally, before breakfast and before bed are ideal times to give meds at most camps. Many folks with Down syndrome, of course, are on thyroid medication. So Synthroid is a brand name, levothyroxine, there's others. And ideally, they're given pre-breakfast on an empty stomach. For some of our folks who can't swallow pills, maybe they're given with a bite of applesauce, something like that, a bite of yogurt. But think about, as you fill in those med forms, is there any way to simplify what has to be given? And if your loved one needs to take the medication with something like applesauce, ask, do you need to take it along? Or send some with you. Next slide. So Pearl, somebody asked about supplements or made mention of supplements, things to pack for camp. I think you really need to think about, is the supplement necessary, whether it's a weekend away or a week at camp? Now, again, some of our folks are schedule driven and routine driven, and it's disruptive. But if you have to send the supplements in the original bottle and the bottle comes from Costco, it can get really messy. So think about, can you just go on hiatus for the multivitamin? Can you forget about the iron that needs to be given Thursday afternoon with lunch with orange juice when that happens to be a beach day? And that is the last thing on the individual's mind, is slowing down to take their iron. Consult with your healthcare team, make sure it's okay to skip. I will say I wouldn't skimp on the bowel routine. You're on a different schedule at camp. There may be less time for toileting, maybe less fiber in the diet. And constipated people are a little grumpy. So think about maintaining that bowel routine. If the person is pretty specific that they need to have their Miralax in apple juice, again, you want to reach out and plan for that. If somebody's traveling on a plane, medications need to go on the carry-on. If they are, going to, I was the team doc for Special Olympics trials for World Games in Utah this spring. And so most folks came in on a plane, but the folks from Utah who drove to get there often had their meds in a regular suitcase or the bigger carry-on that went with a bus to the hotel, and they didn't have it with them. Most of the time, the medical team is going to have to visually check all the bottles. It's the rules, and just, again, make sure you know them and be flexible. Again, if you're going to do something like blister packs, you really have to plan in advance, so there's times for processing. We also know, for many camps, you're signing up in January and doing the paperwork for a July camp. If things change, don't forget to go back in and update the forms. If you're not traveling with the individual to the destination to camp for check-in, keep a list handy in case you get a phone call, because the particular medication regimen just doesn't seem right to the person who is dispensing the medications. Next slide. Mentioned a little bit, insulin pumps are beyond the scope of this presentation, but they're phenomenal and they can make camp accessible for type 1 diabetics who may not have had that opportunity before, but it may require advanced planning. So somebody, usually the pump is going to need to be changed during the week, or the continuous glucose monitor. And usually it's the individual who's going to have to do the changing with some supervision. So plan ahead for that. For patients who need to monitor their blood sugar and use a simple handheld glucometer, they may know how to use it, but if their blood sugar is low and the reason their blood sugar needs to be checked is because they're acting a little goofy, they're not going to know how to. And all these meters are very different and require different steps, different amounts of blood. So, really, I think of Katie's lovely visual stories, like send a visual study story with the glucometer. I'll have to say, at some of these programs, it's a doc volunteering to give meds, and we got no training in this stuff. And if I don't have one of my nursing or ENT colleagues, I'm going to be scrolling through all the instructions. So make it simple. And then for patients who are at risk for low blood sugar, what's the plan? Send glucose gels or tabs. But if you use jelly beans at home or Hershey Kisses, send them with some instructions on how many to have. Next slide. So asthma. There's almost no reason anymore to have to send a nebulizer to camp. But for some of our folks, it is. And if that's a requirement, do it. But we know there's good evidence that if you use a handheld inhaler and use a spacer bar attached to it, it delivers as much asthma medication as does a nebulizer. It also doesn't require electricity. You can get a prescription and see if your insurance will cover the spacer. They often run anywhere from $25 to $40 in the retail setting. I've had some patients purchase them on Amazon. They're a lot cheaper there, and a prescription isn't required. Some of our young adults and adults with Down syndrome think that a spacer is just for kids, but it's not. Tell them it has to do with the physics of the particle size of the inhaled medication or something like that. And I think it's a best practice regardless. I actually had one of my patients at camp who was having a flare of her asthma, and she didn't have a spacer. And I saw her in the office not too long after camp ended. And I was like, I feel like I failed you. I didn't make sure you had your spacer, and you had such a tough time that afternoon at the beach. And it turns out there was an eye roll, and my patient eye rolled her mom, and she's like, my mom thought it was too much to carry. But see, Mom, I was right. So send those spacers. This is actually Aiden, who's Helen's son. I think we have time to play it. And I was amazed with his inhaler and spacer technique at camp. And I got Helen to do a video. So here you go. I don't know if there's anything we can do with the volume of the video.
This is when we reshared the screen, the button wasn't clicked for the audio.
Oh, okay. Well, I think you can sort of see by example, and maybe I'm sure Laura has a way out that we're sharing the slides. I think it's a PDF. We can send these videos But just we'll take a minute to look because Aiden's communicating very well non-verbally here, and you kind of get the sense of what he's doing. We know our folks with Down syndrome like to see other people with Down syndrome doing things. So here's Aiden doing the count, how long he keeps the spacer bar to his mouth and the breaths he takes. And it's just very well done. So Helen may have thrown Aiden under the bus a couple times with his footwear, but he is the best spacer user that I know. All right, next slide. All right. So again, just to highlight, the supplements and herbals can be a big pill burden. A lot of times I know with Camp Pals, we get up early. You're taking meds before breakfast, you're walking to a dining hall, then you might be getting on a bus. And sometimes it's a school bus with no air conditioning. And it's hot and it's bumpy. And so one of the things that I carry now as the camp doctor is barf bags because people end up throwing up. So, if you don't have to give that handful of supplements for the week, skip it. But do remember, if you have to, in many cases, you'll have to supply the original container. The other thing is we know some of our folks with behavioral complexities, anxiety, insomnia may use CBD or THC. So THC, medical cannabis, CBD does not consider to contain THC, so it's not a controlled substance. But there can be issues in a camp setting, certainly if you're traveling internationally. So leave those back at home. If there's some reason where there's a necessity that they have to go with the camper, I think you really need to get that cleared in advance. If somebody always does their CBD before bed, well, then you really have to think about practicing with some melatonin the couple weeks before so they know they have a viable option. Next slide. So rescue and as needed, or we call PRN meds. So think about an action plan and write it down. For Special Olympics World Games trials, the athletes were allowed to self-carry. We had a young woman with migraines, and it was the second day, first day they'd been on the mountain. There was all kinds of excitement. There was a big banquet. She started to get a migraine on the way down. She grabbed her medication, which was actually her preventive medicine. By the time the dinner show was starting, she, poor girl, vomited in the middle of the table. And so we brought her back to her room. She got cleaned up. We found her rescue meds, tucked her in bed, and she was fine by the next morning. But what we worked on during that time was really kind of pre-packaging her rescue meds and labeling them so she knew what they were. She was not an individual with Down syndrome. She actually lived independently in the community with minimal support, but she was out on a whole new adventure, and just all the excitement, the lack of processing time. She was like, I know how to do this. And I was like, I know you do, but today think of all the amazing things you did. And it was hard to get this one right at the end of the long day. So make it easy. Make it so you don't have to think and things are automatic. Again, you want to know, is your individual allowed to self-carry? Depending on the camp, they may not be able to, but you need to have your documents that you send in advance say they're going to need to have their asthma inhaler available for off-site events. I'd err on the side of caution, and if they've ever used their rescue inhaler in recent years, I'd send it along to camp and make sure they have spacer if at all possible. Next one. Just a couple other pearls. Some of our folks don't swallow pills well, so you have to send liquid meds. Sometimes TSA will open them up and not close them all the way. It is a big old mess. If at all possible, If you're traveling by car, other routes, bring a new sealed bottle of the medication and store it in a separate Ziploc bag from the rest of the medication. So if it gets damaged, everything is not lost. If you need to use a pill crusher to give meds, send your own, not something you really want to be sharing. Again, find out, do you need to send your own apple juice pudding juice, or is it provided? And can the individual be a little flexible? Yes, they normally take it in apple juice, but will a Capri Sun work in a pinch? And then think about that whole lifelong learning. So maybe the individual couldn't swallow pills when they got diagnosed with hypothyroidism at age 12, but they're 19 now and they do lots of other things. Try again. There's great videos online to learn how to swallow pills. There's special devices like pill cups that might be helpful, or maybe it's time for a speech or OT consultation. Again, you want to practice this well in advance. So it's not a surprise. The photo on this page is just a reminder. We were spending a long, hot day at Dorney Park. A lot of our folks are on medications that make them not tolerate heat well. People with Down syndrome in general can be challenged by the heat. So really stress hydration. If your camper is on medications that the doctor or other healthcare provider has warned you may make it harder to tolerate the heat, let the medical team know in advance. So commonly see this with some seizure meds, but just keep drinking and have a good time. Next slide. Again, with travel, most of the time medications are going to need to be in their original prescribed packaging, and the med planner doesn't work. In some cases, after check-in, the individual may be able to be responsible for their own medication distribution, and then they can transfer it to a med planner. So you may just send it along, but it, in most cases, is not the primary way you bring the medications in. Think about sending a written prescription in case medications are lost or need replacement. I think this is becoming less important as more electronic prescribing options are available, at least for events that take place in the US. And next, I'm going to turn it over to somebody from the Adult Down Syndrome Center.
Thank you all so much. You shared such a wealth of knowledge. We do have a few more minutes, so if anyone on the call would like to put in some questions into the chat or the Q&A, we can ask our presenters those questions. We also received some in advance, so if the presenters don't mind, I'm going to ask some of those questions. One was specifically about CPAP. Can you share some ideas about CPAPs on trips? Can they go without for a few days, or what are other ways to manage that aspect?
Oh, so I'll answer that one, or try to. So if it's just a night or two and the person is used to skipping their CPAP or BiPAP for a night or two, sure. But if they faithfully use it, I would try to bring it with you. If you're with Special Olympics, and certainly with Camp Pals, which is all people with Down syndrome, we had a lot of CPAP and BiPAP users. If you're not flying, you can bring the jug of distilled water with you. For the Special Olympics trials, the medical team went out and purchased gallon jugs for everybody because people were coming in on planes and wouldn't have them. So I would try to stick with it. I would really try to get the individual to learn how to use their own machine. And to Katie's point about consent, they should feel confident saying, no, I got this. I put together my CPAP every night on my own. I really don't need your help. we had one experience at camp where a well-meaning peer, flooded the individual's CPAP machine because the reservoir got overfilled and she used tap water, even though the distilled water was right there. So, like glucometers, the machines are all different. So if you think there needs to be troubleshooting, send some instructions or a social story. Again, in a pinch with the devices, you can actually find a catalog online, which can help, but I would really stress the independence factor here and requiring consent before you let anybody else touch your device.
Thank you. Sorry about that. We also received some questions about finding camps, as well as finding camps that are able to provide support for things like incontinence issues or someone who needs a little bit more one-on-one attention.
That's a tough one in terms of camp options. I mean, I've learned more as a mom, certainly, than a doc. My social worker at our FAB center and our DS consult program, they scribble down pick lists from other families. So I would ask around about that. In terms of incontinence, that can be a little bit tougher. And for some programs, it may be a requirement that the person is continent. That said, I think if it's known that they have trouble with urine control and you pack, or they usually wear pull-ups or panty liners, poise pads, I think that's fine. Again, much like menstrual products, they just need to know how to dispose of them. I think the incontinence with bowel movements is a little tougher. Obviously, if there's a medical team, we're going to pitch in if somebody has a problem. And we know when people are out of their usual routine, they do. After a certain number of episodes, though, there may be a conversation that maybe you need to work on some skills, or maybe, you're too under the weather to be at camp this year. I think to Hannah's earlier point, though, if the wiping's not perfect, well, oh well, send twice or three times as many underwear as that needs to go, and just encourage an extra change of clothes in their backpack and to toss out that underwear and put on a new pair. Sending wipes can also be helpful. You need to have some discussions about best disposals for toileting wipes, because some of the camp's plumbing is really not going to hold up to that. But if you send it with a little bag, or they can wrap it in a paper towel and put it in the garbage can, that's fine.
I know around us in the Philadelphia area, there are some camps that are up in the Poconos that provide a little bit more help. So I think it's really dependent upon what region you live in. With Special Olympics camp, before we take our athletes and go up to Pittsburgh 5 hours away, we make sure they do at least a couple of overnight regional opportunities. So like the Fall Festival at Villanova, we have one at Penn State. So we kind of use those as kind of training or experimental things to see how they would do. Because the last thing we would want to do would be head away and not have the athlete be ready for like such a very active experience. You have to be pretty independent to go to that particular camp. But there's all different ones with different amounts of support, and that's where it's important to know where you need support and find the right fit. I wish there were more opportunities for people that maybe needed a little bit more support, but that's a great question.
Thank you. There's a question in the chat. What about for deaf individuals who don't wear, I believe that CI's, cochlear implants, or hearing aids when going to sleep, waking up, showering, etc.?
I mean, I think, again, it's the conversation with the camp ahead of time. I know for Camp Pals, we were interviewed, my son Aiden was interviewed before they accepted him at camp to make sure that they are going to be successful and that they can provide the support that they need. So I think it really is dependent. But I could see, like, even in our camp, if I did have an athlete who was deaf with me at camp who communicated with sign language, and she had a cochlear implant as well. And we knew that, so that we made sure we were in front of her. I went over and kind of like tapped her in the morning to help her wake up. So we supported her the best that we knew. And we tried to learn, sign language as we went as well. We all learned a lot of sign language that week. So I think it just depends. Another great question.
Just to add to that, I think whatever you do at home with that individual would be important to educate the staff or wherever your loved one would be going. So if you use a lot of lights for things, making sure you can try to send those, or again, there are certain signs, or if there's a different way to communicate with them, making sure that you're able to send that, or you can prepare the staff so that they can make sure that it's a successful experience for the loved one.
Thank you.
And not to endorse Camp Pals, but each in Camp Pals, every camper is paired with a peer. And you can actually have peers who volunteer to be your camper's partner. So one of my patients had a long-term friend, and they both went to camp together, and that's what they did. They were always paired. The patient had a stroke between Camp Pals last year and this year. It was actually one of her rehab goals to get better, to go back to camp. And her peer worked with her along the way and learned some of the routines to help with some activities of daily living. So they were, primed and ready to go. And so the other things we've done at Camp Pals for patient with type 1 diabetes and celiac and some other medical problems, also on CPAP, she was paired with a nursing student. And that was really helpful. So again, you want to see how creative the programs can be, how creative you can be. We're resourceful families. And I think the big thing is try to do skill building well in advance. But if your person doesn't have the skill, just be open and honest about that. Because maybe it's no big deal, but maybe they need to delay and perhaps try camp again next year and work with BT, OT, speech to get the skills they need to be successful.
Thank you so much. And thank you all so much for attending this webinar. We are out of time. We really appreciate your contributions and are so grateful to our presenters. So we will be emailing this recording out, and we hope that you all have a wonderful rest of your day. Thank you.